Hello, Assalamu alaikum wa rahmatullahi wa barakatuh. Our lecture today will be about immune response against transplantation, okay, or transplantation immunology. By the end of this lecture, every student will be able to define types of organ transplantation, discuss immunological mechanism of each type, and identify the complication of organ transplantation. Okay? Type. What is the organ transplantation? Oh, what do we mean by transplant or transplantation? Transplantation is moving of organ from one body to another, or from donor site to another location on the same person. Either. So transplantation is a movement of organ or tissue, either from person to person or from one side of the body to another side. Okay? Types of transplant organs or grafts. دارين نشوف what are the types of transplant organs or the graft. They are three types. Okay? Autograft, allograft, and xenograft. So it is the three, or they are three types: autograft, allograft, and xenograft. Let us start by autograft. Autograft, from its name, auto mean self. Okay? Autograft is organ transplantation or moving of organ or tissue within the same person. Okay? Same person body. So allograft is transplants that perform between two subjects in the same species. So from human being to human being. This is allograft, but from person to person. Okay? And xenograft is transplant of organ or tissues from one species to another. Okay? And a good example for this is heart valve or broken heart valve transplant, which is quite common and successful one. In valve replacement, one of the valve that we used in transplant or in replacement of the valve, we use broken heart valve. Okay, and it is successful. So organs that are commonly transplanted are kidneys, skin, liver, heart, and bone marrow. What is the mechanism of immunopathology of rejection؟ لأن نشوف immunopathology of rejection. The T cell, especially CD4, play a central role in allograft rejection, but antibodies have also the role. T cell with both components CD8 and CD4, but mainly the CD4, okay, play a central role in allograft rejection, and antibody also have a role. So graft rejection, okay, is mediated by two arms of adaptive immune system. Is mediated by, or is cellular mediated and antibody mediated. We will go and discuss how this occur later. Okay, recipient T cell recognize allogenic MHC in the graft by two ways. You know that MHC is glycoprotein, okay? And you know that T cell does not recognize antigen unless this antigen presented أو processed and presented by antigen presenting cell. So when I insert graft, okay, or I did grafting of say kidney, okay, the donor T cell recognize the antigen in the kidney, in these kidneys, by two ways. Either the donor antigen presenting cell in the graft present its own antigen to the T cell, ده بسميه direct allorecognition. So antigen presenting cell of the graft present antigen to the T cell, to recipient T cell. This is direct allorecognition. يعني هي تقدم نفسها، تقدم الانتيجينز حقتها كويس للrecipient cell. And or the second mechanism is the recipient antigen presenting cell, okay, take the antigen of the graft and process it and present it to the recipient T cell, and this we call it indirect allorecognition. okay, نشوفه في البيكتشر عشان نشوفه. here the green one is donor antigen presenting cell. The donor antigen presenting cell present its own antigen to recipient T cell, and this is direct allorecognition, and this is the most dangerous one. Okay, and in the second or in the lower picture, if you look at the left, the antigen presenting cell of the recipient take the antigen and process it to the recipient T cell, and this is indirect allorecognition. This is the role of T cell. Also B cell have a role. It recognize donor alloantigens and produce antibody that cause complement activation and destruction of the graft tissue or graft organ. Okay, types of rejection. There are 3 types of rejection. There are 3 types of rejection. The first one is hyperacute rejection. Hyperacute rejection. هو acute but it is hyperacute. So it occurs within minutes after transplantation. When I move organ from person to person, and there is reaction occur within minutes. It occur on the table, okay, في الثياتر قبل ما أنا أنزل العيان within minutes. Okay, this is, we call this reaction is hyperacute reaction, and this hyperacute reaction characterized by thrombosis of the graft vessels and ischemia and necrosis of the graft. أنا بشوفه قدامي طوالي immediately. It is mediated by antibodies, and these antibodies is preformed. Okay, it is mediated by preformed antibodies, specific antigens on graft endothelial cell, and for blood group antigens or HLA molecules. So يعني there is antibodies that already present in the recipient body, okay, and this antibody is specific against antigens in the graft. okay, يعني هي already synthesized and already يعني موجودة أصلا يعني الانتيبوديز دي. okay, ما حصل يعني secondary immune response or يعني داب الانتيبوديز حصل to يعني take long time to perform antibodies. This is antibody جاهزة. Okay, and this antibodies is specific for the antigen in the graft, and this antigen may be blood antigens or blood group antigens اللي هي A and P or rhesus, and may be due against HLA molecule. These antibodies and this hyperacute rejection occur in two cases: when there is blood group incompatibility, when one of the antigen is blood group antigen, and it occurs also when the patient is pre-exposed to donor antigen. حاصل قبل كده exposure للدونر antigen, like previous blood transfusion, previous blood transfusion and the recipient exposed to donor antigen before the transplantation, and pregnancy or previous transplantation. So the recipient body is exposed to this antigen before transplantation. Okay, so this antibodies is already formed. It attacks the graft within minutes. Okay, preformed antibodies attack the transplant organ, and this lead to activation of complement antigen antibody complex, activate the complement via classical pathway, and clotting system, resulting damage and thrombosis of the graft, and reaction may be severe, lead to systemic inflammation that can cause death. Okay, here this is the antibodies. It recognizes the antigen and it activates the complement system, and the complement system lead to formation of MAC and chemotaxis of the other WBCs or leukocytes, and this causes inflammation and thrombosis and damage of the transplant organ. Here you see this inside the blood vessel. This is a blood vessel. This is a blood vessel endothelia. The antibodies is against antigen in the blood vessel endothelia, and this lead to the complement activation and inflammation and thrombosis and damage of the graft. Treatment is rapid removal of transplant organ immediately, and usually we prevent this by blood grouping and do cross matching. نعمل tissue typing اللي هو we try to match HLA, try to transplant organ, the donor have HLA that similar or near similar to the recipient. ونحن قلنا إنه ما في there is no two person have identical HLA typing, but with some similarity, okay, or to some degree, except identical twins. Okay, right. Acute rejection. The second type of rejection is acute rejection. Acute rejection occur within days to weeks, and it is mediated by T and B cell. Okay. Hyperacute rejection mediated by antibodies, but acute rejection mediated by both B and T cell mediated and humoral mediated. Right. CD8 cells come and directly injure the graft and destroy it. It will be activated and it will release granules that cause cytotoxicity and damage of the graft. And CD4 secrete it is cytokines stimulated or activated and secretes cytokines that lead to inflammation and activation of B cell to secrete antibodies. Antibodies attach to the graft and stimulate classical component of the complement system and lead to inflammation of the graft. So both humoral and cellular mediated or both arms of adaptive immune system are involved in acute rejection. Hyperacute rejection is humoral mediated. It's mediated by antibodies. But acute rejection is mediated by both cellular mediated and humoral mediated. Okay? And this is acute rejection. The T cell have a role and antibodies also have a role. Lead to inflammation and damage of the graft. Also here inside the blood vessel, قلنا antigen on the endothelial cells will be recognized by recipient cells and cause inflammation and damage of the graft. Patient usually present with severe pain at the site of the graft, okay, or transplanted organ, and they may have fever, generally unwell, okay, and investigation will show high inflammatory markers. And the treatment of acute rejection is by increased immunosuppressive therapy. Okay, we have to increase the dose or we have to add on immunosuppressive drugs. Okay, and are some example of immunosuppressive drugs: cyclosporine, tacrolimus, mycophenolate mofetil, and antithymocyte globulin. And also we can give patient intravenous corticosteroid, intravenous steroid. Okay, so acute rejection occur within minutes, okay, and it is mediated by both T and B cell, okay, and we treat this hyperacute rejection by increased immunosuppression, and we can give intravenous steroid. The third type of rejection is chronic rejection. Chronic rejection occur in months or years, and it occur due to chronic inflammation. So if there is chronic inflammation in the graft, this will lead to chronic graft rejection, and it characterized by fibrosis of the graft and loss of function of the graft and fibrosis of blood vessel that decrease the blood supply of the graft and atherosclerosis. Okay, so chronic graft rejection occur within months or years, and it leads to fibrosis of the graft and fibrosis of the blood vessels that supply the graft, yani atherosclerosis of the blood vessel, and lead to damage of the graft and loss of its function. And this chronic graft rejection is mainly mediated by T cell. So it is mainly cellular mediated immunity, okay? And the T cell secretes cytokines, هي CD helper cell secretes cytokines that cause proliferation of fibroblasts and vascular smooth muscle. Antibodies also have a role, but the main cell that mediate chronic graft rejection is T cell. Okay, antibodies also have a role in chronic graft rejection. Okay, here this is the this is the chronic graft rejection. If you see here, there is chronic inflammation, okay, and this is atherosclerosis, حصل fibrosis of the blood vessel and narrowing of the blood vessel that supply the graft. okay, and lead to also fibrosis, بيكون في fibrosis of the graft and loss of function of the graft. Treatment of the chronic rejection, it is refractory to therapy. It is refractory to treatment. When fibrosis occur, it is irreversible. Okay, and so we have to prevent this chronic graft rejection by immunosuppressive therapy, and we have to do good HLA matching. Okay, we have to do good HLA matching, and as I said, fibrosis is irreversible. This is, if this is a three type, or these are three types of the rejection. Hyperacute rejection اللي هي antibody mediated activation of the complement and damage of the graft, it occur within minutes. And here the acute rejection, it mediated by both T cell and antibodies, and lead to also inflammation of the graft. And this is a chronic infection, chronic rejection, in which there is fibrosis of the blood vessels. These are blood vessels. Okay. Graft versus host disease. Okay. Graft, the name, graft versus host disease. يعني the graft attack the host disease. Usually when we graft organ, or when we do transplantation of the organ, the recipient body attack the graft, but sometimes the graft attack the recipient body. The graft attack the recipient body. So graft versus host disease, we call this, when the graft attack the recipient body, we call it graft versus host disease. Okay. So graft versus host disease is a common complication following allogenic tissue transplantation, especially stem cell or bone marrow transplant. Okay, what do you think? In case of transplantation of stem cell or bone marrow transplant, this transplant will attack the body, because stem cell transplantation or bone marrow transplantation contain WBCs, and these WBCs contain T cell, contain B cell. These WBCs, or these leukocytes, will attack the recipient body and cause graft versus host disease. Okay. So immune cell, اللي هو leukocyte inside the tissue or inside the graft, recognize the recipient host as foreign, and the transplanted immune cell then attack the host body cell. Okay. يعني شنو، تيجي من برا وتحاول تطرد ناس البيت. It attack the recipient cell. Okay. Here this is a bone marrow transplant or stem cell transplantation. Okay. It contains WBCs, or it contains leukocyte, mainly T cell, and this T cell will attack the body of the recipient. The classical picture of graft versus host disease العيان بيجيني بشنو؟ characterized by damage of the liver, skin, mucosa of the gastrointestinal tract or other mucosa. So the patient present with damage, skin rash, and ممكن يجي بجوندس, يعني hepatitis, diarrhea. Okay. So graft versus host disease, it is due to donor T cell, so it is cellular mediated. يعني هي type 4 hypersensitivity, هي delayed type hypersensitivity action. زي إذا مذكرين الليكشر بتاعت hypersensitivity action, it is delayed type hypersensitivity action, and it occurs in bone marrow transplant, and commonly, or the common presentation is diarrhea, rash, and jaundice. So it affects the gastrointestinal tract, affect the skin, and it affects the liver. And time of onset varies from person to person. Okay. And what are the causes of these graft versus host disease? One of the causes is mismatched HLA. Okay. Oh, we have to do good HLA matching. Okay. And immune deficiency of the recipient with immune graft competent. And then هشيل the graft or bone marrow or the stem cell from immunocompetent person, have competent WBCs, have competent T cell, okay, and then I insert this T cell to patient that immune deficient, that patient have immune deficiency, okay. So the competent cell will attack the body of the recipient. So prevention of this graft versus host disease is by matching the HLA as possible, okay? And we can destroy the T cell when he mediated by the T cell, so we can destroy the T cell in the bone marrow of the graft before transplantation. يعني أنا أخذ الstem cell and أعمل T cell irradiation, okay? Irradiate the T cell from the graft, بعد ذاك أعمل الgraft, and we can give a strong immunosuppressive therapy. So, in general, complication of the transplantation. What are the complications of the transplantation? The complication of surgery, like bleeding, like infection, and so on and so. Okay. Rejection of the graft. Okay. Graft may be rejected. Okay. And infection. There is some viral infection that may infect the graft. Like the common virus is cytomegalovirus and Epstein-Barr virus. This graft, these two virus is, and also a virus called Boiculovirus. These viruses is, or these viruses are cause infection usually to the graft. Also hepatitis B and hepatitis C and HIV, okay, like any surgery. And complication of immunosuppressive therapy, malignancy, and recurrence of the original disease. Do you have any question? Thank you.